We're going to be discussing the Society of Obstetricians and Gynecologists of Canada's alarmer mnemonic for the management of shoulder dystocia. Shoulder dystocia here being the impaction of the baby's anterior shoulder on the maternal symphysis pubis. A. A stands for ask for help. You will benefit from the presence of anesthesiology, obstetricians, and more nurses in the room to help deliver the patient. For the baby, pediatrics and NICU nurses will be helpful. L. L stands for lift the legs. You want to hyperflex maternal legs as high onto the abdomen as you can get them. This may release the dystocia by one of three mechanisms. Firstly, you rotate doing this maneuver rotates the symphysis up and out a bit. This may just increase the diameter of the pelvis enough for the baby to come through. Second thing you're doing is you're actually flattening the sacral promontory. Thirdly, just the motion may be enough to shake the baby's shoulder loose off the symphysis. A stands for anterior shoulder disimpaction. This is attempted two different ways. First way is through suprapubic pressure. Have a nurse get her hands behind the baby and with a CPR style hand position rock back and forth. You want to have the nurse's hand positioned behind the baby's anterior shoulder. Attempt this for about 30 seconds. If that's ineffective, attempt the same thing internally. Place your fingers posterior to the baby's anterior shoulder and attempt to rotate the baby forward as such. Let me demonstrate. What you're wanting to do is have two fingers posterior to the baby's anterior shoulder and then rotate it as such, hopefully rotating the shoulder off the symphysis. If that doesn't work, you move on to the R, which is rotation of the posterior shoulder. First maneuver here is called the Woods maneuver, or wood screw maneuver. Keeping the fingers behind the anterior shoulder, you introduce two fingers in anterior to the posterior shoulder and attempt to rotate the baby through the pelvis with simultaneous pressure. So you're trying to rotate the baby through the pelvis like this in a corkscrew fashion. Demonstrating externally, you have two fingers posterior to the baby's anterior shoulder as such, and you place two fingers anterior to the baby's posterior shoulder, and then you attempt to rotate the baby like this. Okay. That's the wood screw maneuver. If that doesn't work, you reverse it. So you place two fingers anterior to the baby's anterior shoulder, two fingers posterior to the baby's posterior shoulder, and again, with simultaneous pressure, attempt to rotate the baby through the pelvis in a corkscrew fashion as such. So for the reverse wood screw, you have two fingers anterior to the anterior shoulder. You have two fingers posterior to the posterior shoulder. And again, you try to rotate the baby through as such. Sorry, it's a bit tough to show. Okay. That doesn't work. You move on to manual removal of the posterior arm. Place your hand into the vagina underneath the baby and run your fingers along the humerus. Once you get down to the antecubital fossa, the baby's forearm should flex at the elbow, at which point you grasp the forearm and either pull straight out or sweep the forearm across the baby's chest, again attempting to rotate the baby out as such. You do have to go a long ways in with your hand. E. E stands for episiotomy. Remember, this is a bone-to-bone dystocia. So just going in and making a soft tissue cut will not release that, but it does give you more room to place your hands in for the maneuvers. R. R stands for roll the patient and also for rescue maneuvers. With regards to rolling the patient, take the mom and rotate her onto all fours. In doing so, the pelvis falls about 1 centimeter off the spine and opens it up enough that you may be able to get the baby through quite easily. And you just do the exact same motions you would, gentle traction downward. And the baby should deliver quite nicely with the extra room. If it doesn't, you then do the same maneuvers. 2 fingers posterior to the anterior shoulder, try to rotate the baby through. And again, two fingers posterior to the anterior shoulder, and again, 2 fingers anterior to the posterior shoulder, and again, try to rotate the baby through. And as well, you can do the similar reverse wood screw. It's actually called the Gaskin maneuver. There are a number of rescue maneuvers mentioned in the literature. I'm only going to discuss 2 here. 2 I won't discuss are the posterior sling and fracturing the clavicle. The 2 I will be discussing are the Zavanelli maneuver and symphysiotomy. So for symphysiotomy, you inject local anesthetic just above the symphysis, and this is made out of cartilage. You then place one hand into the vagina and move your urethra out of the way. Take a scalpel and begin to cut down through the cartilage. Once you get about halfway through, it will actually just pop open, giving you a lot of room to deliver the baby. I've not had to do this in practice, but I have had 2 spontaneous symphysial separations in my career. Both women healed up quite nicely with a belt around the pelvis for about 6 weeks. Finally, the Zavanelli maneuver, made famous in an ER episode, can be done if 1, you have ready access to a cesarean section, and 2, you've not cut the cord. In the Zavanelli maneuver, you reverse the cardinal movements of labor. You flex the neck, rotate to OA, push up, and do a section. So what you do is you flex, rotate to OA, and then push up with a cesarean. That's your Zavanelli maneuver.